Dear Professor Muresanu, thank you very much for this interview about the CAPTAIN trial. You have been involved in these innovative trials from the very beginning. Can you share some of the important characteristics with the medical community?
Yes, the CAPTAIN trial investigated the efficacy and safety of cerebrolysin in traumatic brain injury patients with a baseline Glasgow Coma score between 7 to 12 points. The patients receive a daily dose of 50 milliliters cerebrolysin for 10 days as add-on to standard therapy. A particular feature of our trial design is the treatment schedule with 2 additional 10 ml daily cycles of cerebrolysin at 30 and 60 days after trauma.
Why did you add these 2 treatment cycles?
So our group of researchers has applied new findings from basic research and the learnings from past clinical trials with cerebrolysin in traumatic brain injury and of course from other indications. So prolonged or repeated exposure to the biological agent registered the stronger effects, especially in cognitive and behavioral outcome domains. And our hypothesis in this study was to investigate if this approach to treatment with cerebrolysin would result in improved recovery of the patients after traumatic brain injury.
And were these aims achieved? Please tell us a bit about the results.
So we are happy to report that our hypothesis was confirmed. The CAPTAIN trial results indicate superiority of cerebrolysin as compared to placebo at days 30 and 90 after traumatic brain injury. The endpoints were part of a multidimensional approach to measure the global status of patients using a combined multivariate ensemble of 13 scales and subscales focused on neurocognitive outcome.
This is excellent news, bringing new hope to millions of TBI patients. Can you explain why you chose this endpoint in favor of a more traditional one like the Glasgow Outcome Scale?
So TBI research has failed to show clinical benefit of pharmacological interventions in over 30 years. Since no single measure can capture the multidimensional nature of traumatic brain injury outcome, the use of multiple measures is considered much more appropriate to address the breadth of potential deficits and recovery following traumatic brain injury. Based on the international mission on prognosis and clinical trial design in traumatic brain injury, namely the IMPACT group, we know that we have recommendations and stronger experience in this respect for CAPTAIN trial, and the steering committee planned a multidimensional analysis using combined full outcome scales, including, of course, measures for anxiety and depression.
Positive results in neurotrauma trials have been extremely rare, while the medical problem is devastating for patients and caregivers. What is your take-home message?
So treating patients after a traumatic brain injury is a daunting task that requires a multidisciplinary effort. Physicians should be aware that most patients require long-term care, despite self-reported improvement in global status immediately after the injury. Active and consistent follow-up and screening for the development of cognitive impairment is highly encouraged. The evidence from our trial now provides clinicians new treatment options in addition to standard care for patients after moderate to severe traumatic brain injury.
Thank you very much for this interview. It was nice talking to you.
It was a great pleasure, and I hope this will be useful also for our patients and, of course, for future research.